That was fascinating indeed, and also sets the tone for our next panel discussion to discuss the digital future in healthcare and sustainability. Please allow me to welcome on stage our moderator, Mr. Zaka Jacob, Deputy Executive Editor, CNN News 18. Let's have a huge round of applause to welcome him on stage, please. Well, as the magazine Business Today puts it, Mr. Jacob is a calm and collected anchor journalist with a nose for news and an ability to get to the heart of the matter. So with all your heart, once again, let's have a huge round of applause for our moderator of the discussion. Thank you, sir, for joining us. Joining him as co-panelist is Dr. Ajit Thomas, an associate professor at the Harvard Medical School. Currently serving at the Beth Israel Deaconess Medical Center, Boston, Dr. Thomas is an accomplished senior neurosurgeon with more than 25 years of experience. He was at the forefront of introducing cutting-edge technology in medical procedures and a recipient of several awards for innovations and excellence in the medical instrumental design. Once again, let's welcome him on stage. Joining them is Ms. Anuradha Acharya, the founder and CEO of Map My Genome, a leading genomics company that leverages DNA sequencing and genotyping technologies to the screening for genetic predisposition and diagnose complex genetic disorders. Ms. Archana was named Young Global Leader by the World Economic Forum in 2011 and served on the WEF's Global Agenda Council of Personalized and Precision Medicine. Thank you for joining us, ma'am. A huge round of applause once again for her, please. Next on stage with us as a co-panelist is Dr. Azad Mupen, who's the chairman and managing director of Aster DM Healthcare, which has built one of the largest networks of healthcare facilities of over 323 establishments, consisting of hospitals, clinics, and pharmacies in the Middle East, India, and Philippines. Mr. Mupen was awarded the Pravasi Bharatiya Samman and the Padma Shri by the Government of India for contributions to the Indian diaspora and social service. Maybe again here for him, please. Thank you. Thank you, sir. Our next panelist is Mr. Bhagwan Chogle, who is the CTO and co-founder of the US-based Trini Sustainability Solutions. Mr. Chogle has over 15 years of experience in conceptualizing, architecting, and implementing technology solutions for large enterprises. He's responsible for the creation of sustainability performance management platform that enables enterprises better management through sustainability spending and its differentiations and impact. Can we hear once again for him to get them warmed up on the stage with us as panelists? We also have with us Mr. Prashant Warrior, the CEO and co-founder of Cure.ai. Mr. Warrior has architected and commercialized several data service solutions. He's passionate about using AI and machine learning to make healthcare affordable and accessible. Mr. Warrior was the co-founder and CEO of AI-powered advertising technology startup Imagna, which was acquired by Fractal Analytics in 2015. Thank you, sir, for joining us today. And the last, but definitely not the least, is a panelist, Mr. Duleep Sahadevan, the CEO of Software Associates, a company that provides IT and ERP solutions to global SMEs. Mr. Sahadev is a member of High Power IT Committee of Government of Kerala and has served as a regional council member of NASCOM. Welcome, sir. Maybe again here a huge round of applause and then hand over the stage to Mr. Jacob to take the discussion forward that we're so looking forward to. Thank you very much.
Thank you very much. Good afternoon to all of you, and thank you for being so patient and waiting for what is the last panel for the day. I'm just letting everybody walk in after the tea break. So the topic for the final panel discussion this afternoon is the digital future of health and sustainability. Healthcare, as you all know, is one of the largest industries in the world, and yet it happens to be one of the most regulated, and that's understandable because your life depends on healthcare and the kind of healthcare that you get, the quality of healthcare that you get. And the digital revolution that seems to have affected every other sphere of our lives is also certainly changing healthcare for the better, most parts. I think today's discussion is essentially to try and understand how digitization is going to change the interaction between doctors and patients and how it's changing the entire ecosystem around healthcare. So we'll be talking about a whole range of subjects within that paradigm. We'll be talking about artificial intelligence. We'll be talking about how the whole paradigm between doctor and patient has changed, telemedicine, online care. These are things that you're going to hear of a lot more in the future. So how can Kerala, with its large pool of health workers, whether it's doctors, nurses, and of course digital professionals, IT engineers, hardware engineers, and so on, how can you benefit from this fantastic interface of a surplus of healthcare professionals and digital professionals? So we're going to divide the discussion in 3-4 broad areas. One, of course, is going to be what is the future of healthcare vis-a-vis the digital interface in the future? How can Kerala benefit from that? And we'd like to also open this up to both question and answer sessions within the panel, and of course, we'll have audience questions as well in the last 20 minutes or so. And if you do want to ask a question to one of our panelists, you can go to this app, Kaizila. I think everybody who has a smartphone knows about this app. You can go into that app and just feed in your question, and when we get to the audience session, we'll read out your question to whoever it is addressed to. So our lead panelist this afternoon is Dr. Ajit Thomas from the Harvard Medical School. I would request you to open the discussion for us this afternoon on the future of healthcare and sustainability.
Thank you, Mr. Jacob. Do you have a slide mover? This is forward. When you talk about healthcare innovation for the future, there are really two broad overarching themes. One is the role that new molecular biology techniques, genomics, and genome editing will change. But Anuradha is going to talk about it, so I'm going to leave it to you. The second part is to do with digital technology, artificial intelligence, data analytics, virtual reality, robotics. And I think this pictorial best summarizes it. From 2017 to 2030, you can see how digital technology will transform healthcare. The first thing is medicine is often reactionary. When you have a heart attack, you go to the hospital, you get your coronary arteries fixed. But we want medicine to change to be predictive and preventive. We've talked about the preventive mantra for 30, 40 years. But what is going to change now is the amount of data that's available to figure out what happened. Why did the heart attack happen? Can it happen to you? And what specific steps based on this can you do to prevent a heart attack? For example, lifestyle modifications using apps, blood pressure control using sensors, frequent monitoring of EKGs. If you look at a disease like diabetes, with the newer technology, you can monitor diabetes from home. The patient is self-aware of what's happening to the patient's blood sugars. He has a vested interest in it, and he's an equal partner with the doctor in managing it. Similarly, you'll see later on how artificial intelligence can actually prevent some of the complications like diabetic retinopathy and other problems. The next thing you see is that medical care has always been provider-centric. Everything is geared towards the to making it easier for the doctor and the hospital and the medical providers in general. But that will change. And I think as one of the best parts of digital technology is it's going to make healthcare more democratic. And it's going to give this ownership back to the patient. And the patient is going to be more the focus of healthcare. The products that you have to make will be more designed with the patient in mind. And I just want to show you this example of this MRI scan. On the left hand, you see an MRI scan, which we used to use for children. Children found it hard to go inside the scanner, and about 80% of the time, we had to anesthetize the child. On the right side, you see the new GE series, Adventure Series scanner. You can see how it's made like a Disney World. And now, with this, the child goes into the MRI scanner. It's like it's an exciting time for the child, and the incidence of anesthesia has dropped to 20%. So I think you'll see more and more of this patient-centric kind of innovation. The next thing is data that is presented to the doctor or the patient is often discrete. You go to the hospital or the clinic, you get a blood pressure taken, instead of having a continuous data feed which spans months or years. And that continuous data feed often helps make better decisions. It also is made possible because the smartphone has become the most important, it will become the most important part of healthcare because it is the portal through which a lot of these things will happen. On the left hand, what you see is Cardio Mobile. Dr. Moopen actually has one where you can fix that to the back of your smartphone and you can transmit your EKG to anybody, to any place you want to, including your physician. On the other side is a blood pressure monitor. Again, when you take your blood pressure, it is sent to the cloud and to your medical records. Similarly, glucose monitoring, weight monitoring. The difference is the patient is seeing this, you can modify your behavior, the physician has access to it, and you can see your data over a long period of time and can make educated decisions. If you look at the hospital, everything is in the form of an app. The electronic medical records are complex, and to make it simple, an app is layered over it so that it can distill the data that is going to be useful to the provider or the patient. And why is it so relevant for Kerala? Because as we all saw in the morning, the internet or the mobile penetration in Kerala is about 95%. We have a highly educated group of people who are very invested in their health. So we would be a prime target for these kind of healthcare-related apps and therapies. If you look at activities on the internet, you'll find that social networking and shopping is the commonest one, whereas health-related apps are way down. But I think as time goes on, you'll find that the healthcare-related apps will form a major proportion of our efforts on the internet. The other thing technology will do is, so far, technology has always increased the cost of healthcare. You buy a new MRI scan, you pay more. You have a new laser treatment, or you have a new surgical therapy. But the newer treatments and the newer technologies coming in through digital technology will actually make healthcare cost-effective. It will improve the delivery of healthcare. If you look at Kerala's healthcare expenditure, the GDP, the per capita spending is approximately about 7,000 rupees, which is about $100. In the OECD countries, especially the United States, it's $9,000 per year. So it's 90 times. But the irony is the life expectancy of a Malayali is 75 years, whereas that of an American is only 79. So it's not that spending 90 times bought them a lot more. But the other part of it is that we are, whether it's India or America, we don't have a lot more money we can spend on healthcare. So we have to be cost effective. The other big tsunami that's coming across is we have an increasingly aging population, and we would need these kind of technologies because an aging population has more healthcare needs and it's going to be more expensive. So again, we need these kind of technologies to actually reduce the cost of healthcare. And the last bit is, so far we depend on individual expertise or the heroics of the individual doctor. But this will change. With the kind of analytics we have, you have a virtual team and an artificial intelligence which will make a lot of these decisions. What is artificial intelligence going to do? I think we'll hear a lot more about it. But in my opinion, there are three things. One, it helps you to auto-diagnose. So whether you look at a scan or data from monitors, it helps you diagnose, auto-diagnosis. Second is disease stratification. What is the risk of getting a heart attack or a stroke or your diabetic complication? And the third is the treatment recommendation. If you have cancer, what kind of a chemotherapy drug would help? What kind of a blood pressure medication or psychiatric medication will help based on your genomic data and other things. So I hope that's a broad overview of.
Thank you very much. Can we have a round of applause for Dr. Thomas? I think it's fantastic what you mentioned about how healthcare of the future is going to go from provider-centric to patient-centric and from reactionary. I mean, you think about it, you have an illness, you go to the doctor looks at the symptoms and he treats the symptoms. It's always been reactionary. How do you go from reactionary to preventive? And I think that comes most to the fore in genome mapping. So I'd like to introduce our second speaker on the panel this evening. Anuradha Acharya is founder and CEO of Map My Genome. And she'll be talking a little bit about how you can predict diseases and how this could significantly bring down healthcare costs.
Thanks, Saka. Let me just put up a few slides. Let me see. Yeah. So essentially, I'm going to talk a little bit about how genomics can be used towards getting us towards a healthier future. So I think the most important thing is that Kerala tops health index in India, but that's currently, right? So how can it continue to lead, and will genomics help them keep that lead in the states? So the question really is that, we heard a little bit about why genomics, because you can find a lot of things about disease predisposition and others, but I think the real cause is the real paradigm shift, and I think Dr. Thomas sort of touched on that in his talk, but the real essence of this is that we are moving away from us saying that my doctor is responsible for my health towards saying it's me and my doctor who's responsible. And it's not just that the doctor is given limited tools, but the doctor is now have access to a lot more tools than they had before. And genetics is one of them. And the reason that is becoming so is that from $3 billion just about 15, 18 years ago, today the cost of sequencing has come down very rapidly, and the cost of analysis has become easy. So because of the changes that have happened in terms of cost and technology, I think it has become much more accessible. And over the next 3 to 4 years, I think we'll find this falling down even more further, so much so that it'll be equivalent to getting any other blood test or something else done. The other thing I think we've also talked about is a little bit that genetic testing can be used not just for saying which chemotherapy is going to be good for a cancer patient, but it can be used for a lot more things, which is saying, can we prevent something, can we predict something, and how do we personalize a particular treatment? So there are multiple things that we can do. But the real important thing, I think, is what we have touched upon, which was to say that whether it's the doctor or whether it is doctor-centric or patient-centric, I'd like to call it consumer-centric, because I think by the time you go to a doctor, you've already become a patient. But the idea is that if you look at the curve over there, the low risk and the low cost is at the early stages, at the stages where you can prevent a disease versus late chronic. And given the fact that all of us spend 62% out-of-pocket money to be able to get access to healthcare, and for most of us in this room, probably we spend 100% in getting healthcare costs, I think prevention becomes a necessity. So I think here is the big problem that we are trying to solve, saying that we form 20% of the world's population, but the amount of data that was there in the world today is only about 0.2% of genomic data. And I think that's the point that we hope that if we have enough genomic information for the Indian population, I think that helps us solve many other things. So these are the three broad areas. I think one is the prevention. You can understand a lot of information, whether it is about understanding of self, whether it's about traits, whether it is about saying whether you have a risk for a particular disease like diabetes, cancers, neurological condition, but you can also understand whether certain drugs will work for you or not. And the other and the most important thing that will come in the near future is the fact that once you have enough data points, it can be used for much better predictions using artificial intelligence. So I think it has been validated not just by the fact that cost has come down and others, but if you look at what is happening across the world, you find that 35% of the drugs that are today being, that the FDA is today now approving are more or less personalized medicine, which means that you are moving towards an era which is no longer going to be one drug fits everybody, towards now saying there are very specific drugs that are going to be suited to specific population. And I think that's real proof that that is where healthcare is heading towards, right? And beyond this, I think beyond the fact that you can look at disease predisposition, you can look at whether drugs will work for you or not. There are future technologies like gene editing, and I won't talk a lot about that, but I thought I'll just put that in, where you can potentially in the future edit embryos to be able to produce specific types of babies, more specifically called as designer babies, right? So I think the way I look at it, when you look at yourself, you are a combination of your DNA, your environment, and behavior. And if you just need to understand how you're going to understand how is genomic going to help you, I think there are 2-3 important things. One is that how do you actually get to do a genetic test, right? And I think for most consumers, I think that's the part that most people don't understand, that it's a fairly simple process. All you need to do is, whether it's your hair, whether it's your saliva, whether it's your blood, it contains your DNA. And it can be done as a direct-to-consumer. So people can actually order something online. It comes to you, you do it, and you can get access to a lot of information about yourself. And then you can do things like genetic counseling, which will allow you to understand what these reports mean. So you don't necessarily have to go to a medical doctor before you finish all of this. Then you get a report that will sort of put all of this together. Now you go to a medical doctor. So the doctor now has access to a lot of information, even if you go to a specialist. Because today, I think most of us go to a specialist when we have a particular problem. We are getting lesser and lesser of the family physicians. So I think, as the consumer becomes more central, and you have genomic data, you have phenotypic data, you have clinical data, you have imaging data, you have activity data, and you have more data, and you combine all of that with artificial intelligence, I think that will help make better decisions than humans with the tools that we have. So why shouldn't we invest in genomics? Because that forms the base. So that's where I would like to
Thank you very much. Can we have a round of applause for Anuradha Acharya? I think it's fantastic. Genomics in a state like Kerala, for example, where people have family histories of diseases like cancer or diabetes, even heart ailments, I think would be a real boon. So if you do have a history of any of these diseases, I think it's a good idea to get your genomics tested. Let me now introduce our third speaker. He's a physician turned entrepreneur. He's now a philanthropist, but somebody who knows very well the potential and the power of digitization and the digital penetration in healthcare, and how can Kerala benefit from this vast pool of healthcare workers that it has, doctors, nurses, paramedics, and how do you combine that with artificial intelligence? So, Dr. Azad Moopen, the floor is yours, sir.
Thank you. Thank you very much. So my presentation is going to be very, very simple, not very futuristic, but something very practical. So if you look at this is the past. This is 50 years back when I was 15 years old. This is the telephone that was there, and this is the bus which was there. My father used to book a call to Calicut from Tirur, and along with that, send somebody on the bus to get the message. And many times, the call was not connected, and the person used to come back with the message, you had gone in the bus. That was 50 years back. We have changed this to a situation where iPhone on our fingers gives you world over connectivity, and the Hyperloop connects you to the whole world. So we have come to this level. But what has happened to healthcare? The real healthcare, whatever we are speaking here, is to a great extent theory. What is happening even now for me to see a doctor is to call or take an appointment on the phone and then go to his consultation room and wait there for half an hour or 1 hour and then see him and then get a prescription. Maybe he will order for some pathology test, do that, go back to him, get the medicine or prescription, go to the pharmacy, collect the medicine and come back, which was happening 50 years back when I was a 15-year-old student, and the same thing is happening even now. So healthcare has stood still to a great extent, at least in the primary care, even though we have done very well in some areas. I'm not saying that we didn't do well in areas like investigations with MRIs, with CT scans, with our even robots and all. We have done great. But we have stood still in that area, which is very important to the day-to-day care. Now, this is changing. What is the reason for this? As has been mentioned here, the healthcare information is in silos. It's not being transmitted. It's sitting in paper files and it is sitting in the doctor's office and spread over worldwide. There's a requirement for this data to come together, which is the greatest, most important thing. It has to be, configured in such a manner that this is available to the doctor who is seeing the patient, which is not happening. So that is one part of it. The other part is how are we now, the problem which I mentioned, how are we going to address that? That is through telemedicine, and that's what I am going to talk. It's a very wide subject. I am just talking to you very briefly about it. Telemedicine is now, luckily in the last 5-10 years, catching on. And even in our country, we have this coming on. There are various parts of it. There is telepathology, teleradiology, telehematology, telecardiology. I am just talking about the common telemedicine, what is happening in the world and what is coming to India also. So this is very simple. You are having a doctor who is sitting in a hospital or in a clinic and the patient, and there is a connection between the patient and the doctor. And there are, apart from directly speaking to the patient, you also can connect many of the equipments to the patient, and that can be transmitted to the doctor. So that without seeing the patient, the first thing which I told, which took nearly half a day or 1 day, can be accomplished in a matter of just half an hour. And that is happening, and I'm sure that in the next 4 or 5 years, this is going to happen. But this has got much more than that. This is a simple primary consultation. Beyond that, this connects you to huge potential of connecting the whole world to your doctor and to yourself. If you want a second opinion, and if you want to go somewhere and get an opinion, it takes you years, days or weeks, whereas here, within no time, you will be able to get an opinion from somewhere if you go to your doctor, and your doctor will be able to get a second opinion in no time. And this is the second opinion facility which is happening with any doctor. But this also has got this significance in a country like India, where we have a lot of people who are in periphery, who are actually in the rural areas, who are not connected. May not be in Kerala, but when you go to other countries, other states, you will find that many places are so remote that they have to be connected with the doctor which is not possible. So this has got huge significance, and we in the state have got that advantage of having large number of trained doctors, nurses, and paramedics who can provide this service to such people. Maybe in Africa, maybe in countries where you don't have this, we have that capability of providing that. So you have teleradiology, for example. It is another part of that where radiologists can read the X-rays taken in different parts of the world, sitting in Kerala, which is a huge opportunity for us to explore. This is another one where even on your mobile phone, you can see a CT scan. The doctor can see a CT scan and give a report which is coming either from your hospital or which is from some other country. Now, telepathology is there. A pathologist need not be there. In many of the remote areas, you don't have a pathologist, whereas this can be done through the telepathology slides. So this is another thing, e-ICU. This is a great opportunity for us sitting in Kerala. E-ICU is nothing but monitoring the patients in a remote country, maybe a patient who is in England or in US, where the cost of monitoring is very huge. You can monitor them sitting in Kerala. If we have trained nurses and doctors, these patients can be monitored in Kerala or in any part of India, which is a huge opportunity which should be really explored. I am not going into the details. There are a lot of opportunities which are being opened up. We can, as an extension of that, we can provide medication to the patient through drones and things like that. So what I want to just submit is that telemedicine is a huge opportunity for better patient care, which can be much more easier as well as much more economical, as well as it will also help us to reach out to the people who are world over, who require healthcare, who don't have doctors to do that. In India, we have a deficiency of 600,000 doctors. And in foreign countries, like in Africa and all, it is much more. So telemedicine is a solution which I think from sitting in Kerala, we can really utilize it for helping these people. Thank you.
Thank you very much, Dr. Mopan. I think the potential, the opportunities, I mean, just thinking about it, you know, are we a few years away from a cardiac surgeon being able to perform a cardiac surgery sitting somewhere in England or the United States? Thank you very much for that presentation. Talking about, you know, the patient-doctor-government interface, what's the role of government? What can government do in this kind of an instance? I think who better to have than Dilip Sadevan. He's right at the very heart of the government-doctor-patient interface. He's a member of the HPIC. You have a presentation. Oh, you can, okay, yeah. Can we have a round of applause for Dilip Sadevan, please?
Thank you, and good evening, distinguished members on and off the dais, ladies and gentlemen. I'm a first-generation entrepreneur. I'm based out of Kozhikode. I come from a medical community. We've lived with a lot of classic physicians who treated patients without even touching them. And a whole lot of legendary stories which even Dr. Azad Mopan might be able to share at some point. I'm going to touch upon three aspects. One is the newly formulated government healthcare policy. It is in draft mode. It is available to public. You could have a look at it. You were most welcome to give your comments so that we could have the final version. The second is the digital state of Kerala. In fact, when we have, earlier somebody said we are at the forefront, you know, we are with the Nordic countries. When the rest of India talks about smart city, we are talking about a smart state. So let's first look at the digital enterprise. I think in about 2 or 3 months' time, we're going to have the K-Phone launched. 8.4 million families are going to be connected. The below the poverty line, which is about 1.3 million, they're going to get free internet. So it is going to be the most digitally connected state, or probably the largest digitally connected state population in this part of the world. The second phase, we were going to have the wireless communication, which is essentially what we call as a narrowband. Now, the narrowband has been adopted in countries like Singapore. For example, the Singapore government has put the smart sensors inside a mousetrap so that you don't have to go every morning and to figure out which mousetrap is empty or full. And it also prevents the mouse from decaying and causing plague, etc. So imagine having these small devices put on oxygen cylinder. For example, day before yesterday, somebody died on the way to the to the hospital because they ran out of oxygen. So if you are able to have a narrowband network across the state, we could put this on oxygen cylinders. We could look at the cleanliness of the toilets in our public sector, the hospitals. We could look at how the elevators work. We often find that the patients are going to a hospital and the elevator doesn't work. Well, we have the largest share of geriatric as a percentage, currently at about 12.3%, above the age of 60. So Ajit has already spoken about the geriatric. So once we have the digital network in place, there are a whole lot of opportunities for both the public as well as the private sector to work together to build an intelligent health network. The second one is regarding the government policy. I think earlier we saw the slide on the Ardram. The health policy says that one, the government clearly admits that the demand far exceeds capacity. So 30% of the current population goes to the government, the 70% is catered by the private sector. The government is looking at transforming the public health community services. They are looking at reducing the number of people. They said it's a catastrophe that even for a toothache, you come to the medical college, whereas you could actually go to the primary health center or you could go to the family health center to get your problem solved. So the last mile is still a big problem. Somebody in a remote area like Attapadi has to travel close to 120 kilometers to come to Trichur to get a scan done. Now, is there some way that we could reduce this last mile problem? Is there an opportunity to Uberize healthcare? Can the public and the private sector work together to see probably an Airbnb equivalent? So can a patient in one of the remote areas go to a private hospital and probably get the same treatment? I mean, these are some of the opportunities that we need to look together and see what can be done. The other area that I want to talk about is, with the connected world, we're going to have a whole lot of opportunities for smart devices. Wearable is one, affordability. Can that be Uberized? Can that be given at 5 rupees a month to the geriatric patient rather than him buying it? Can there be a public-private partnership to ensure that the security, the safety, as well as the wellness of the patient is really taken care of? The policy also talks about wellness. You look at, again, when we go back to the advanced countries, you look at, for example, the University of Utrecht. Because they built bicycle lanes, over the last 5 years, the government has saved nearly 300 million euros in terms of wellness, in terms of sustainability, reduced pollution, etc. So a lot of governments are actually spending money on the wellness part of it to ensure that the healthcare cost comes down. These are some of the points that I would like to touch upon. The last one is, I worked predominantly in rural markets. My software is also not cloud because many of the places where I sell the software, there's no internet. So it's an on-premise solution. So my core competency is that I sell in the border of Bihar and all these rural markets. So there is a Bharat market and there is an India market, which is the affordable and the non-affordable. Here our question is that how do we make health affordable and approachable of, available to the poorest among the community. Thank you.
Thank you very much, Mr. Sahadevan. I think, one of the points, again, one of the earlier speakers talked about 30 million mobile phones, and how can you use those smartphones so that people, even for a toothache, don't have to come to a medical college, or people in remote areas don't have to come to a city to get a scan. The other side of it is, of course, what can artificial intelligence do? Will it take away jobs? Will it replace healthcare professionals? Is that a threat? To try and answer that, I'm going to give the floor to Prashant Warrior. He's from Cure.ai. He also has a presentation, right? Yes. The floor is yours. Prashant Warrior, ladies and gentlemen.
Thank you so much. I mean, everybody spoke about the lack of radiologists, physicians, doctors, right? And what I'm going to talk about, I think we have the wrong slide, wrong presentation on there. There was a different presentation called Future Talk. It was in the pen drive. So one of the solutions is obviously, telemedicine, getting access through radiologists or healthcare providers in the cities. But another way to look at it is through new technologies, and artificial intelligence is one of them. And what I'm going to talk about today is more about, we hear a lot about AI, and I know that there are a lot of technology folks here, a lot of technology practitioners. And what I would like to talk about is what it takes to build some of these technologies, what it takes to build an AI technology which can automatically interpret, let's say, a X-ray or a CT scan, and talk about some of the real-life use cases that we are working on of using AI in healthcare. And so primarily I focus on radiology, so I'll talk about the radiology space, but that's where we'll focus on. I think you have the right presentation now, so you can switch it on. Yeah, perfect. So in 2015, so AI has been around for, several years, many years now, but a lot of the growth has happened in the last 5 to 6 years and happened through a lot of work happening at Google and Facebook and some of the universities in the US, right? In 2015, when we started Cure.ai, algorithms could do this. So it could basically label this image of a dog jumping over a bar and say that it's a black and white dog jumps over a bar. And that was a label created by an algorithm by looking at millions of images like this along with their similar captions. Right? And we asked ourselves the question, can we do the same thing with this image? Can we train an algorithm to label this particular X-ray and identify whether it's abnormal or normal, or even create a fully automated report based upon the image itself? But this is a hard task, right? So, even a 4-year-old child can look at that image of a dog and say that it's a dog jumps over a bar. But to be able to figure out which of these X-rays is abnormal takes easily 8 years of expertise beyond your schooling days. So here, for example, among these three, this left one, the first one is the one which is abnormal. And the abnormal region in that X-ray is very small. It's just a few pixels in that image. And the algorithm has to be able to figure out those few pixels, and based upon those few pixels, it has to be able to say that this particular X-ray is abnormal. And what that takes is, so when Google or a Facebook, they build these algorithms, they build AI algorithms which can, for example, allow you to search on your phone for photos of a beach, and it gives you all the photos of a beach. Or you can do face recognition on Facebook, for example. It'll identify people who are, it'll identify the names of the people in your photographs, right? They are trained on millions and millions of images. So they have millions and millions of labeled images. So one of the things that we did, first thing that we started out with was to collect a data set of a large number of images, which is probably around a million plus images, or around 3 to 4 million images, with the corresponding reports. And the idea is to train the algorithm the same way that we would train a radiologist, is that you show the radiologist an image and the corresponding diagnosis, and the radiologist would learn from seeing examples, right? And we said, of course, the algorithms are not as smart. So a radiologist would learn in maybe 100 images or 1,000 images. For an algorithm, you need to provide it millions of images. But that's what we did. We gave it a huge amount of data and let it figure it out on its own. And the underlying technology is fairly, I think these are fairly standard now. They are available for use. They're open source. And of course, you have to work on it a lot more, but these are all artificial neural networks. So the input is basically an image of, for example, an X-ray, and the underlying technology is basically layers of neurons, layers of artificial neurons. These are up to 50 million parameters, right? And the output would be, for example, whether that X-ray that is input to the algorithm is normal or abnormal. So that's That's what it takes. I mean, so you basically have a lot of parameters being fine-tuned, and each case you present, it learns, it fine-tunes its parameters, then you keep on presenting more and more cases, and the algorithm learns from seeing those cases, right? Now, how do you apply this, right? So one of the challenges, I mean, and we had a NTB summit last week in Delhi, where it was inaugurated by Prime Minister Narendra Modi. And for India, I mean, for the world, we want to eradicate TB from the world by 2030. But in India, we want to eradicate TB by 2025. So we have a much more aggressive target than what we have set for the world. And TB, one of the challenges is that a lot of people are not diagnosed through the TB detection protocol. And that's because the TB detection protocol is fairly lengthy and expensive. So you have to first, I mean, go and meet a doctor, and you may not have access to a doctor where you live. You have to then take an X-ray. You have to then do a diagnostic test, which is basically a microbiological test called a gene expert test, which will confirm whether you have TB or not. And all of this costs up anywhere from $30 to $40, $50, I mean, around the world. And so in the world, only out of 10.4 million cases of TB, only around 6.1 are actually detected using the TB detection protocol. And one of the things that happens is I mean, a lot of people in rural India, rural Africa have to walk kilometers to get to a center where they meet a doctor, they take an X-ray, and there is no radiologist available to read that X-ray at the point of care. And that then takes them 3 days, 4 days to get back with the results. And these patients are busy. I mean, they probably do not go back again, and you lose those patients, and you don't provide them medication, right? And what we are bringing in is this capability to automatically read a scan. So you can automatically read an X-ray and identify where exactly the abnormalities lie, so that the algorithms that we have trained, I spoke about earlier, can now, I mean, look at an X-ray and create a report like this on the right side, which will identify all the abnormalities that you can see on the X-ray. It can also localize where the abnormalities lie, so which part of the lung is affected, whether it's the left or right lung or the middle lung, upper, middle, lower, and so on. So this technology is being tested out, being tried out in multiple locations for the screening and diagnosis of tuberculosis. And this is a huge challenge, I mean, huge challenge across India. I mean, 1/4 of the TB burden in the world is from India, and it's a huge challenge in Kerala as well. A second problem that is really, I mean, it's happening live use of artificial intelligence is in the reading of head CT scans. So one of the challenges is every 2 seconds, someone somewhere in the world is having a stroke, right? And typically, stroke can be caused due to a bleed or a clot in the brain. And if it's a clot, you would actually treat that patient using blood thinners. But if it's a bleed, you would not do that. And if you give a blood thinner to a patient who has a bleed, that patient may not survive. So you want to make a quick diagnosis. Typically, the recommended protocol is to take a head CT scan. And once you take a head CT scan, you need a radiologist to read that scan. And then you need for the physician to figure out what treatment, whether to give the blood thinner or not. And this sometimes, I mean, especially when you are looking at emergency care centers, in the night, they may not have a radiologist available on call to be able to figure out whether there's a small bleed in the CT scan or not. And it could lead to a significant delay or even a misdiagnosis and wrong medication being given to that patient. And again, one of the things that we can do is left side you see is a CT scan of the head. It's a image. It's basically CT scans are 3-dimensional objects. So it's just a picture of that converted into a video. And on the right side, you see that for the same CT scan of the head, now you can see that the algorithm has marked out the regions where there is a bleed. And it's automatically done that. All of this takes a few seconds. And so as soon as a patient comes in, gets a CT scan, immediately the algorithm can tell you whether there is a bleed or not. And based upon that, the doctor can take the right course of action. And this is the kind of report that comes out. So it's automatically saying that there's an extradural hemorrhage of which part of the brain is affected, there's a fracture, midline shift, and so on. So it can automatically create reports such as this. And I want to close by saying that, I would bring, what is the future of this kind of technology, right? And there are companies, Cure.ai is one of them, but there are many other companies around the world working on many different modalities. Somebody's working on chest CT, somebody's working on sonographies, and so on. So what is the future of this is that in pathology, for example, when you look at digital pathology, which is your blood test, your simple complete blood count test in the 1980s was completely manual. a pathologist used to look into a microscope and count the number of white blood cells, red blood cells, platelets. And it used to take them up to 20 minutes to do one blood test. Today, that is a fully automated process, and the pathologist can focus on some more advanced procedures such as immunohistochemistry or histopathology and so on. And I believe that in the future, radiology is also heading in a similar direction, where a lot of the simple tests, for example, a head CT scan or a screening test like a chest X-ray can be automated using the algorithm, and the radiologist can focus on some of the more difficult and more relevant tasks and spend more time with the patient. Thank you.
All right, thank you very much. Can we have a round of applause for Prashant Warrior? I mean, it's incredible what AI can do, other than, of course, taking away jobs. It's incredible that you can actually have a radiology test that's done after going through millions of images, where a machine can detect what is wrong with you without any kind of human interface. I think that's incredible what it portends. But our final speaker today is Mr. Bhagwan Chaugule. He's an expert in the field of sustainable development. And I think it's very clear. I think it's obvious now that our lifestyles, our modern day lifestyles with the kind of pressures that we have, workplace and otherwise, it's just not sustainable. So I think part of preventive medicine has to be alternate lifestyles. So he'll be speaking about sustainability, and he's somebody who's worked very extensively on sustainable development goals. So I leave the floor to you. He's our final speaker, Mr. Bhagwan Chaugule.
Okay, thanks, Jaka. Good evening, everyone. So in fact, I requested Jaka to allow me to speak towards the end. So I'm bringing in a different perspective out here. So we heard all the speakers, and we know how we are using technology to diagnose the diseases at early stage, probably even help cure those diseases. And so that is more on reactive part. If we look at genomic, it is a preventive measure that we can take to ensure that we are taking care of all the diseases that may happen in future in advance, ahead of time. But while looking at all of this, we also need to focus on another area, which is there a possibility to take some proactive measures? Is it possible to ensure that we don't fall sick? And that is where sustainability comes into picture. So when we talk about sustainability, it refers to triple bottom line: people, planet, and profit. So when the people, the pillar in sustainability, is about good health. In fact, if we look at all the discussions happened today, we are trying to use technology to have a good health, good life for all of us. And if we consider this journey of doing anything with a good life, we can see that the diseases are taking us away from this track. And we need to think about, so all other measures are going to help us, bring us back on the track of a good life. But we also need to think about what do we do to ensure we are not taken away from this track of living a good life. And that is where sustainability comes into picture. So these are externalities which impact, influence our health. And we definitely need to take care of all these externalities, which is quality of air. Now we all know what happened in the winter in Delhi. So besides carbon dioxide, there are a lot of elements in air which are making it, polluting it, which is impacting our health badly, which is NOx, so nitrogen dioxide, sulfur dioxide. It is also ozone or carbon monoxide, which is impacting our health. But besides that, the particulate matter now is really causing a lot of lung-related diseases. The particles which are less than 10 or 2.5 micron are directly entering our lungs and creating problems. So air quality is really very important. At the same time, we are contaminating water like anything. And it is not only industries which are contaminating water, but at the same time, the domestic pollution of water where we are adding a lot of chemicals. So interestingly, if you see, we are using almost 6 to 7 different kind of soaps. So different soap for washing hands, different soap for cleaning floor, washing clothes, washing utensils, a different soap for even washing our hairs. So all this is going into a water which, unless treated, is contaminating water sources and which is causing a lot of health issues in the downstream population. So water quality is another important aspect that we really need to take care of. Besides that, we really need to manage our waste in a proper manner. How do we dispose of waste is causing a lot of problems. So I think in one of the session earlier today, someone was asking about what do we do with the waste being generated in big cities. It is really very important we take care of waste. So besides dumping it in a ground outside city, or besides landfilling, which is causing some problems, when it rains, actually during monsoon, the entire waste goes back in the water source, which again pollutes water. So these are really important aspects we all need to take care of to ensure a good health. And unless we take care of all these problems, it is constantly going to add a lot of burden on the healthcare industry itself. I think, so we are definitely using a technology to take off some of that burden or to scale up well, maybe using artificial intelligence, machine learning, predictions, genomic analysis. But at the same time, it is really important we holistically start looking at the externalities which will impact on our health. So it is not only about air quality, water quality, waste, etc. It is also about the food that we consume. So this is, again, a very interesting perspective about health. So we all know that there is a huge impact of inorganic practices that we are following in farming. So the pesticides, the chemical fertilizers that we are using are really badly impacting our health. In fact, you must have heard about a cancer trend which goes from Bathinda to Bikaner in Rajasthan, I guess. So the name of that train is something different, but most of the travelers in that train goes from Bathinda, actually a city in Punjab, to Bikaner, which has a cancer hospital. So most of these travelers are cancer patients. And this is because of huge amount of pesticides being used in Punjab. So we really need to also ensure that what kind of food we are eating. In fact, I would like to mention that Kerala is taking huge step promoting organic farming. It is, I think, the first step which is trying to achieve 100% organic farming. And in fact, I would like to congratulate Kerala government for that. So these are really very critical, important aspects that we need to look at when we talk about health industry.
All right, thank you very much. Can we have a round of applause for our panelists? So a couple of things. What we're going to do is, since we overshot on time for the opening comments, I think we'll go to the audience questions directly. So before I get to that, I mean, so we're not going to have any mics around and people asking questions. If you have a smartphone or a tablet, go to the Kaizila app and you can enter your question. I've got a whole bunch of questions. Before I get to that, I think one of the things that we missed out on is wearable devices, and I think Dr. Moopen has a wearable device which he was talking about when we were in the speakers lounge. It's not just about a smart watch. It's about these specific healthcare wearable tech, which gives you real-time data of your vital parameters, right? If you could just show that to our viewers, sorry, our audience here, and then I'll get to the audience questions. Do you have a mic?
No, I was just, I'm wearing a watch, which most of you must be having a Fitbit or something, but this is a little advanced in the sense that it's actually an activity tracking watch from Apple, where they have recently added a cardia band, which has got a slot on which if you keep your finger, your ECG will be recorded and it will give you a result, whether it's normal or not. If it is abnormal, it will ask you to contact the doctor, or if you're already connected through the app to the doctor, it will give you immediately what is to be done. So the way in which wearables are growing in such a way that for everything you have a wearable now, and this is actually something which is really going to help us in the future. For example, an epilepsy patient, there is a possibility that there is an app which will predict the possibility of an epilepsy quite early. Or a migraine patient, there is a possibility of an app which can tell quite early when it is going to get an attack of migraine. There are a lot of apps, hundreds of thousands of apps there, and even if you go to the Amazon, you will have lots of apps and you will be confused. There are apps which can measure how you sleep, apps which can measure how your heart is, how your diabetes is, and there are lots and lots of apps. And this is a new thing which is going to give lot of data into your personal patient record and help your doctor to come to a diagnosis and help you in live a very healthy life.
All right, thank you very much. We've got a question from one of our audience members. So once again, if you want to ask a question, go to the Kaizila app and just type in your question, and we'll ask that to our panelists. One of the things we did not talk about, and maybe Dr. Thomas can address this, and this is the question from the audience member, when the medical industry becomes more advanced with futuristic treatments, how do hospitals make sure that it's accessible to all citizens at an affordable price? I mean, recently we've seen, at least where I live in Delhi, there is a bit of a backlash against corporate hospitals, big name, chain hospitals, where people are saying that the quality of healthcare that we're getting and the price that we're paying for it, there is completely a mismatch. How do you address that question?
I think what you're saying is very true. There is a dichotomization of healthcare resources. It looks like the more affluent people or the more affluent countries have access to better healthcare and can live a better lifestyle, better diet, exercise. But I think the hope is that, for example, just like the thing that Prashant showed, where a CT scan can read, say, brain images, an artificial intelligence program can read brain images. What it will do is it should hopefully reduce the cost of healthcare. I was just talking about this earlier. We all get diabetic retinopathy if you have diabetes over a long period of time. And if you can get laser treatment for that, it will prevent blindness. Now, the problem is you need to go to a doctor who is highly specialized to diagnose it and to figure out the right patient that has to be treated. But over the last 2 years, Google, for example, has worked with Arvind Eye Hospital in Chennai and some of the other hospitals, and they have created an artificial intelligence program that can detect different stages of diabetic retinopathy, which is better than the best ophthalmologists in the United States who are specialized in diagnosing this. So what it means is that a person in Wayanad, for example, can just get a picture of his retina done, and it can be fed into this algorithm or machine learning program, and they can figure out who needs to go for laser coagulation. So those kind of things will make our lives better. It will democratize healthcare to a large extent and hopefully reduce the cost of healthcare. And eventually, technology, the end goal of technology, as I said earlier, is to help physicians do what they want to do, which is to actually provide good healthcare to all of you in a seamless and cost-effective manner.
All right, thank you very much. We've got a question, I think this is for Prashant. What is the accuracy rate of AI algorithms for detecting brain hemorrhage? And what is the rate of misdiagnosis?
So the accuracy rate is typically, I mean, we compare ourselves against radiologists, right? So what we do is, I mean, when we build these algorithms, we would compare against a panel of 3 radiologists, or more than that, sometimes 5. Compared against a panel of 3 radiologists, the accuracy rate for detecting abnormalities on a head CT scan that we found was in the 95 to 97% range. So what we measure is what is called area under the curve. And so the accuracy rate is in that range, 95 to 97% range. And that's pretty much the range. I mean, if you compare one radiologist against that same panel of radiologists, it's in the same range. I mean, so we are able to detect bleeds, multiple kinds of bleeds, fractures, atrophies at the same rate as a radiologist would be able to.
All right, thank you. I think we've got a question from somebody who wants to know, what about the security aspect of the data that's collected, and how can you ensure that this data is not misused by hospitals or medical companies, insurance companies, even the government? You want to take that, Sardev?
I think in the earlier session, Nandan already mentioned about the privacy aspects of having the data online. I think with the advent of blockchain and like technologies, there would be less worry about the data being misused without being given to somebody else without your consent.
All right. There's another question. It takes a couple of minutes to refresh. Yeah, in Kerala, how do we get massive data, let's say, for X-rays to train for machine learning? Anybody on the panel wants to take that?
So actually, one of the most important things that Kerala needs is some form of an electronic medical record. And I think I was just talking to the Chief Minister and the Secretary earlier, and they said that it's one of their priorities. Because like you said, data drives this whole thing. And unless we have some form of an electronic medical record, we're never going to have that kind of data. The imaging data for X-rays is fortunately available on PACS systems. But again, these systems are all siloed. They don't talk to each other. And so you'd have to go to each individual company or imaging clinic to get the data. But once you have a information highway where this data is freely transferable and there are interoperable systems, which I think that's where the government has to step in. The government has to set up standards so that when these new electronic record systems come, there is a lot of interoperability so that people who do data analytics or artificial intelligence can take advantage of it. Is that right?
You want to add to that?
So I just wanted to add that, I mean, when we started with Cure, I mean, we had this same challenge, I mean, getting access to large volumes of data. But fortunately, I mean, if you're talking about radiology, right, I mean, most of the hospitals in India, or most of the at least private hospitals in India, have access to radiology PACS systems and reporting. So they have access to the images as well as the reports. But when it comes to linking that to, let's say, the patient history or pathology data or other types of data streams, it's not there. But most of the Indian hospitals I have seen have access to at least the radiology data and the corresponding report. So you'd be able to maybe, for example, talk to Dr. Mupan here. I'm sure he has access to a large volume of data here.
See, one thing which I want to highlight is that all of us, instead of being blood donors or organ donors, should take a pledge to become data donors. All of us have a lot of data sitting at our homes, written by different doctors, lot of X-rays, a lot of things sitting at our home, which has to be digitized and go into our medical records. So we are trying with Tata Communications, we already have started a project where we want in our hospitals to have kiosks which can upload the data, either radiology or other data, so that this can be centrally stored and can be available to the patient anywhere in the world. So it's very, very important that all of us now look at how data can be provided so that it can be better utilized.
All right, thank you. Last couple of questions, I think. Here's an interesting one. Is there any kind of algorithm or genome mapping that's available at present for the early detection of Alzheimer's disease? And if yes, what are the metrics that one needs to look at?
Well, we do cover Alzheimer's in genome patri, so that's, there are a few markers that are fairly well established for Alzheimer's. So you can look at it. APOE4 is a well-known one, but there are a few others as well. So the way we would look at it would be based on the relative risk. But there are many ways of also being able to look at potentially seeing if you have a risk for Alzheimer's, what you can do in terms of delaying the onset or reducing some of that. So I think that is one part. The second part is that there are also a lot of new therapies that are coming up, so that hopefully by the time in the next 5 to 10 years we will see a real therapy for Alzheimer's as well.
All right. Another question from somebody in the audience. In fact, it's a doctor. While I see the potential of AI, the investment to get standards and products is going to be extremely expensive. Isn't it cheaper to train more doctors and allow features like telemedicine? I think that, again, instead of focusing on AI, shouldn't we focus on telemedicine because of the large pool of medical workers that we have?
I think that it's not something which is possible, because as I told earlier, there's a deficiency of 600,000 doctors in India, and it's increasing. We have just 50,000 doctors coming out every year, and 600,000 is the lack. It's increasing. And the best thing about AI or a robot doctor is that he can work 24/7 without any sleep or any wrong diagnosis coming out of him throughout the day. So in many ways, I think we have to give the space for the AI in medical care. There are a lot of things which the AI can't do. The doctor has to do the passion, the compassion, the touch, everything the doctor has to do. But there are certain things which are repetitive, which AI can do much better than human beings. And I think we should give that space to the AI, and that will be the best way in which both of this can be married, and we can have a better healthcare system.
All right, I think I'll take the final question again from one of the members of the audience. The healthcare industry is drowning in data. How is blockchain going to help the industry in this data transformation? Anyone? Anyone on the panel who wants to talk about blockchain? Okay, that question has had our panel spellbound.
I'll just give a very simplistic view, and that is that I think when you look at a lot of data forms that come in, like your genomic and various other data types that you're collecting, I think the real concern for most consumers has been privacy of data. And I think blockchain is one of the ways to be able to distribute that data across multiple levels, to be able to, one, ensure that your data doesn't get lost, doesn't get hacked, and the second is it also ensures that your data remains private. And therefore, all the data that can be used for further medical research is easily available and shareable with whoever you want.
All right, with that, I think we'll wrap up this panel discussion. Thank you very much. Can we have a round of applause for our panelists? And thank you very much for your wonderful questions. We had some great questions. Thank you.
Health is always, sorry to cut you, sir. Health is always at the core of any society's development goals. So it makes perfect sense that we leverage all our technological expertise to make our citizens' lives healthier and happier. And ladies and gentlemen, these experts on the stage are truly the torch bearers doing that. A louder round of applause for them once more. One of our panelists is also a member of the HPIC, so I'd like to request Mr. Duleep Sahadevan to present our mementos to the rest of the panelists, starting with Dr. Ajit J. Thomas. I request you to step up and take the center stage while you present the memento. Dr. Ajit. Ms. Anuradha Acharya. Dr. Azad Mupin. Mr. Bhagwan Chowgule. Prashant Warrior. And finally, our extremely brilliant and entertaining moderator, Mr. Zaka Jacob. Gentlemen and the lovely Miss Anuradha, I request you to please step up and please pose for a picture. We need that panel frozen in a picture.